And welcome back. I'm Mabel John. You're watching Day 2 coverage of the World Healthcare Congress here in Washington, D.C. In our studio right now, Melinda Hews, Executive Director, Health Insurance Exchanges, Group Health Cooperative. Hi, Melinda. How are you today?
I'm doing well, Mabel. How are you?
Very well. Now, you're a regional player, so how has the strategy around private exchanges evolved over the last few years?
Well, as a regional player, we serve 630,000 people in Washington State. And so we aren't a national player at this point. And so part of what we have looked at is how our private exchange is affecting, obviously, our regional market, and how can we take advantage of private exchanges to maybe take back some market share we've lost to national carriers over the last few years.
Right. There certainly seems to be a lot of opportunities because consumers are as interested as ever in this area. So what are the challenges, though, of trying to grow your business regionally and taking back that market share?
We have many challenges, and I think part of the challenges is will private exchanges take off, so to speak. So our large employers, everything exchange is kind of a trend right now, but will large employers actually look at this as a way to offer their coverage to their employees? You speak of consumerism, and one of the things that exchanges do is that they allow employees of employers to get a better shopping experience, we feel like.
Well, speaking of the shopping experience, how are consumers responding? Were you able to predict what their behavior would be like when looking at shopping for this kind of product?
Yeah, I think it's interesting because generally speaking, health insurance itself is not a very interesting subject, quite frankly. A lot of people don't really want to even think about it until they have to. And I think more and more as employers are attempting to engage their employees in understanding the foundations of their healthcare coverage, and not so much a healthcare coverage, but it's a ticket to healthcare services, right? Mm-hmm. And so I think the private exchanges offer an opportunity for employers to help their employees pick the coverage that best suits them. In the past, employers generally give people a selection of a couple of plans or more, and people sort of make their own decision. But this gives employees tools to better take in their own considerations around what's important to them in terms of cost, in terms of the providers that they choose, and in terms of what might be going on for them in the coming year health-wise.
Okay, and how has your approach to this changed? Have you had to pivot, and you've learned a lot, I'm sure, over the last few years on how to address this new marketplace, but what are you doing differently?
Well, I think one of the interesting things that health plans need to consider when they're looking at private exchanges is what will it take on the health plan side to actually implement this with an exchange. We're used to being in direct contact with our customers. We usually sell directly or through consultants and brokers to our customers. And at this point, with a private exchange, it creates a layer in between. So often we don't have that one-to-one contact. We actually become a product on a shelf, if you will, in the exchange.
Sure.
And so we have to get used to not having that control and also trying to retain that relationship with our customers. We're not just a commoditized product. We're actually a product that has a lot of moving parts, as you mentioned. And so we've tried very hard to continue to work with our employers who are in exchanges and understand what their needs are, and also work with this new administrative layer that the exchanges bring to us.
Now, why was it important to address the people here at this meeting, Melinda?
I think that the jury's still out on private exchanges around the future of them. There have been a lot of the consultants have projected after the Affordable Care Act came out that larger employers would jump into private exchanges, and that there would be, I heard this morning, up to 18 million people covered in these vehicles by 2018. I think there are probably around 6 million people who get their coverage through private exchanges right now. So we're all watching to see what the next iteration may be and whether or not we should be on the bandwagon, so to speak. So I think health plans here wanted to understand other people's experiences. We were able in our session to talk about some of the challenges around plugging in to the back end of an exchange. It looks so beautiful on the outside,
Right.
but there's actually quite a bit of work and cost to make sure that experience goes well.
Okay, Melinda Hews, thank you so much for your time.
You're welcome. Thank you.
And I'm Mabel Jong. Thank you for watching.